for this opportunity to come together. We ask that your hand be with those who are helping protect our community from virus and from threats, foreign and domestic. We ask that your peace be upon us as we make decisions today. In your name we ask. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. For the purposes of attendance, the clerk will call the roll.
Campbell.
Here.
Connor.
Here.
Geiger.
Here.
Getty.
Here.
Gibson.
Here.
Jackson. Here. Smoker.
Here.
Thank you, Madam Clerk. Approval of written agenda. This time, any commissioner or member of the public may ask for an item to be removed from the consent agenda and placed under items for consideration. Hearing no such request, does any commissioner request to change the agenda? Hearing no such request, and without objection, the agenda is approved as written. Reports from state and county officers. Does any state or county officer or their representative have a report to share with the board? Hearing none, limited public comment. This time, any member of the public wishing to address the board may do so for up to 3 minutes. Various correspondence. Does any commissioner have any correspondence to share with the board? Consent items. Commissioner Getty.
I move to approval of the July 13th, 2021 Board of Commissioner meeting minutes, approval of the July 2021 Committee of the Whole meeting minutes, approval of the July 2021 Board of Commissioners special meeting minutes, approval to appoint William Bill Matson to serve on the Animal Shelter Advisory Board in a citizen-at-large position for a 2-year term that began on 1/1/2021 and expires on 12/31/2022. Approval to ratify the chairperson's reappointment of Brenda Schild to the Berry County Officers Compensation Commission for a 4-year term that begins on 10/1/2021 and expires on 9/30/2025. Referral of the request for map change A2/2021 to Berry County Planning Commission for reconsideration.
Second.
Motion by Getty, supported by Gibson, to approve the items listed under the consent agenda. Discussion is not allowed and the roll call vote is required. The clerk will call the roll.
Campbell.
Aye.
Connor.
Aye.
Getty.
Aye.
Gibson.
Aye.
Jackson.
Aye.
Smoker.
Aye.
Geiger.
Aye. The consent agenda is approved. Presentations. We have 2 presentations today. The first we have from the Road Commission. Brad Lambert. Good morning, Brad.
Good morning. Thank you for having me again. Thanks for allowing us to present our annual report. On page 1. Different year with COVID-19, of course. I probably don't need to belabor that, but we, despite the continually changing science, everything done that we intended to get done.
Yeah.
So we're happy to report that.
Can't hear you.
Safely. Soundly. So,
Brad, can you move your microphone over?
absolutely. Is that better?
Yeah, thank you.
Catherine. Revenues on page 4, revenue on page 4. The biggest light blue portion of that pie chart continues and probably always will continue to be the Michigan Transportation Fund. We are funded through state gas tax and vehicle registration fees. We lost from March through March when the pandemic, the first year alone, about $800,000 out of that chunk there that you see due to COVID-19, simply because it's vehicle registrations and gas tax revenue. And when people weren't driving and stuff that was there. But we did make some adjustments on the next page. You see a corresponding expenditure pie chart. Had to make some cuts due to losses and not knowing when and if the revenue will ever recover. It is recovering. It has not recovered fully yet. But we're glad to report, as you all can probably see, there's a lot more traffic on the roads in the last 6 days previously. So Won't spend too much time on the road route selection process. That's a chunk of the annual report that never changes, but we spend a lot of time with our townships working up that procedure. Will suffice that to say. Next sections you get into are our actual construction quantities and actual construction work for that summer. Starting off with gravel at around 18,000 yards, and then about 31 miles of crack sealing on page 9. Moving through fairly rapidly. Different township reports where we did some overlays come up, and you can feel free to read that on your own, or I'll happy to answer any questions. But page 15 is the condition of Berry County roads. I would encourage you all to visit the dashboards that you can look at Michigan.gov, but also through the Asset Management Council, which is a legislative approved body, and you can get in there and there's a dashboard where you can select county, and you can look at all the roads in Berry County. You can look at just the state roads in Berry County or just the county roads, and you can look any place in the state too, city and village by name, and you can check out conditions of roads. We're pretty proud of the system that we've been able to get in there, and encourage everybody to take a look at that. Another situation with the pandemic, if it's near and dear to me, but the current governor primary slogan for re-election or for election was fix the damn roads, as we all know. When that was pretty hot and heavy in the #1 push, I would say, until the pandemic hit, and now we haven't heard much, if anything, about that here in Michigan. So the state did sell bonds to fix MDOT roads and put us all further in debt to make sure that that got done, but that did nothing for local road agencies, both counties, cities, and villages. So, not sure if it's over or not, that issue or not, but it'll be something for us to see here in the near future. The next page are snapshot of the Berry County Road Commission employees at the end of the year there. I'd like to point out that we consider these employees our #1 asset at the Berry County Road Commission, and them to be your local road professionals. Very dedicated, get the job done, like I said, through COVID, but every year, rain, ice, snow, holidays, Christmas, whatever it takes. So if you ever bump into them in the restaurant or something, please, thanks. Appreciate that. Just a couple things I'll point out. In our appendix, we have some graphs and charts. You can see for years and years, I remember coming here and talking about asphalt prices and material prices increasing dramatically. We've had somewhat of a flattening there the last several years, looking particularly at figure B on page 23. So that's something good that we're hoping if it continues to stay flat. And as you take a look at the revenue in figure A, that was the last gas tax increase and general fund appropriations that were set of several bills passed the fall of 2015 under the Snyder administration. And that increase in revenue that you can see started 16 and moved up through 20 and is now flattening just because the legislators. That corresponds, if you flip over to figure F, if you take a look, that corresponds to an increase in our PASER, it's called, rating system, which is the quality of our surfaces of our roads. So that's a good thing that we're happy to show here in Berry County, that we can make a difference with it, and we have. That PASER rating system is an acronym for a system that we're required to use to rate our paving systems. Transportation Asset Management Council, that's the system that will be referred to. The remaining bulk of this report is, I don't know how many thousand different numbers, but it's a state mandated Act 51 report that if you ever have any questions about, Chris and I back at the office would be happy to spend some more time with you, but I will not bore you by trying to go through that today. So, with that concludes my annual report. Thank you once again, but I'd like to answer any questions if there are.
Questions for Brad?
Well, very much.
Thank you, Brad. Next, we have Rich Temke from the Berry Community Mental Health Authority.
Great. Good morning, everyone.
Morning.
So as the chair had mentioned, my name is Rich Timke. I'm the executive director at Berry County Community Mental Health. So it's been a while since I've been here. Had some conversations with Commissioner Smelker about on the Stepping Up Committee and some things we were thinking of doing there. And so that led to a conversation of there's some newer commissioners, and so it might be a good idea just to come here and let you all know kind of what we do back at our shop. So that's kind of my intent. This morning, so we jumped to
An
the...
ocean or something? I'm hearing waves.
Yeah.
Yeah, I'm hearing that too.
Yeah, it's from the microphone.
Okay, we'll continue.
All right. Is that me? Yeah. Electronic devices, so let's see if that...
We'll just continue.
Okay.
It's not detrimental to the presentation.
All right. So you'll see on the outline here, I'm just going to quickly walk through history, what we do, who we are, traditional services, additional services that we provide in the community above and beyond those traditional services. Quality, of course, we always have people looking at us. And then you may have heard of this push for system transformation at the state level. So I'm just going to kind of touch on that a little bit and then let you know what locally we've been doing for years to kind of prepare for that transformation, which really involves integration of physical health and behavioral health together. So when we turn the page there, we see that Michigan has a rich history of taking care of individuals with disabilities, individuals with mental illness. 1974 was really the marker that kind of got things going. That's when the mental health code was formed, and so that's the foundation, if you will, the Bible of what we do, how we do, and when we can do that. That also started the formation of the boards, the community mental health board. So flipping the page here again. And so you see during that time in the 70s, there were these, I said, community mental health boards that formed. Originally, there were 46 of those. And so the state contracted directly with 46 entities. And that's how that existed for several years, several decades actually, until we get to the 90s. And then the state moved to this regional kind of hub plan where the CMHs kind of grouped together to form regional hubs. And there were 18 of those to start with. And so that's important mainly just for several reasons, but mainly the flow of money. So the flow of money, instead of contracting directly with 46, the state now at that time, excuse me, contracted with 18 of these regional hubs. And then in the 2000s, we just shrunk that from 18 to 10, and that's the same model that we have today. And then turning again, we see in 2014, so Berry County's in what we call SWMBA, Southwest Regional Behavioral Health, along with 7 other counties. And those are the counties you see there that are in that region. And so we've been existing in that since 2014. And so again, for us, that's important to realize because the Medicaid funds and Healthy Michigan funds flow from the state of Michigan to SWMBA, and then SWMBA divides those up to the various counties based on Medicaid eligible individuals within each of those counties. Okay, so what do? We provide comprehensive behavioral health services, substance abuse, co-occurring services, really, I just want to point that out. Focus on least restrictive and really getting people on the path to their recovery, whatever that looks like for them. We talk a lot about wellness. So who we are, again, we're a community that provides comprehensive mental health services.
We're going to take a short recess. We're going to take a short recess.
They're at the center, or they're driving the ship. They're dictating the course of those services. All right, so we turn the page. So what do we do? What are those services? You'll see wide variety of traditional community-based or community health services that we provide. ABA or autism services. So for us, that includes testing, services in somebody's home, as well as clinic-based services, case management, community living support, skill building, whole array of services you see here. I won't go through the whole list, but just to note that those are substance services and mental health services, so again, co-occurring services. We turn the page, we see a lot of services for children as well, home-based infant mental health. A couple years back, we started a children's mobile crisis team, and then we also have peer support and recovery coach services. So that's a service with individuals with lived experience, we would say, that come alongside somebody and help them understand where they're at, help them understand the service as well. So those services that we provide that in the community that are not what you would consider your traditional services. So we started an intensive case management service a couple of years ago. So that's where our case manager, master's level, with a bachelor's level or peer support service person going out to where people are at, just engaging them where they're at, building relationships, and getting them into services. Provide therapists in school. That's been more challenging through the pandemic, and also with some staffing issues. A lot of services in the jail. I mentioned at the beginning how we've been working through the Stepping Up program. For the page there, I'd just like to mention that one thing I'll point out for these additional services on this page, like the signs of suicide, is a service that our prevention team goes around, I think, to pretty much every school in the county, middle school and high school, and educating students on signs of suicide. And if they see or know a friend that is in that position, letting them know what they can do. How they can. I would add to this too that now we do have 3 staff that have gone through the mental health first aid training, and so we will be at some point soon here be able to provide those trainings within the. And then quality, of course, we get looked at and audited on a very regular basis. These are just the numbers from fiscal year 2020 that you see. That comes out and is one of the auditors since the Medicaid and Healthy Michigan funds. And so you can see that we've done quite well. We've received the numbers from fiscal year 21, and they are at or above these levels. And so I'll just point out, like our prevention team received the highest score in the region. And if I turn the page here, you'll see that our autism team also received the highest audit score in the region, so very well there. iHealth Link is a program or a service that looks for individuals that have Medicaid and Medicare. So it's trying to maximize the services available to those individuals without duplicating those services. And obviously, SWIMA audit, that's not how we do that. So kind of wrap things up, like I said, you might have heard of the system transformation that's really been pushed through our state for some time, but the latest two, Senator Shirkey's gearing towards integration proposal, and then Representative Whiteberg, both of these look to transform behavioral health, how behavioral health is delivered in the state of Michigan. My goal here today is not to get in depth to these, just to alert you to these. You may be aware of them already. I would suggest you keep tabs on these. If you want more information or want me to come back, I can certainly do that. But we could argue whether there's good or bad points to those, but the gist of that is the system is transforming. So, lastly, what are we doing locally here to prepare for that transformation? Like I said, the main focus of that transformation is the integration of behavioral health and physical health. Some of those plans will talk about financial integration, but we locally feel that integration really should happen at the front door, meaning wherever that individual walks in. So whether that for us is at our clinic or that's Cherry Health, that's where integration for that person should take place. So they should be able to get those services they need. So we do that in a variety of ways. We've been working on this for years. Care coordination, so if there's changes, adjustments to an individual's plan at Berry County Community Mental Health, we're communicating with primary care physicians. As I mentioned, we are a co-occurring provider, so what does that mean? It means we provide services to individuals that have a substance use disorder, but also have a mental illness. And so we see a majority of individuals that come to our facility have both going on. So our therapists are trained to provide therapy to both of those at the same time. We partnered with Cherry Health here locally for going on 4 years now for a SAMHSA grant promoting integration of primary and behavioral health care. And so, like its name, the focus of that grant is integration of primary care and behavioral health. So we look at who each of us are serving together. We develop, coordinate care and develop plans, similar plans, and then they have huddles. So the primary care team and the behavioral health team, they get together and talk about what's going on for that individual and what's changing in the behavioral health and the physical health. Sometimes if there's a med change, it'll affect one or the other, and so that can get adjusted in real time. And then the last thing I would I guess I would update this that I had on here is what we're doing to prepare for this transformation. We had applied for the Certified Community Behavioral Health Clinic Expansion Grant, and so we were awarded that grant, or notified that we were awarded that grant a couple weeks back here. So that's a little over $3.3 million for 2 years. That will enable us to expand access to services for the mild and moderate, but also access directly to the community. I talked about the intensive case management program, where we're having individuals go out into the community, individuals need instead of having them come to us. So this would allow further expansion of that to things what we call an ACT team, assertive community. Enable us to serve instead of just our defined population that we have now based on Medicaid, all those that have. Willing to answer questions, address those, or come back later if you have further questions or want me to present. Thank you for your time.
Thank you, Rich.
Yep.
Questions from commissioners?
I don't have a question, but I was appointed to serve on this board, and the board and the staff that I've had the pleasure of meeting, I mean, their hearts are in the right places. They're dedicated to improving mental health in Berry County. Thank you.
Okay.
I don't have any questions either, but just a statement on the Stepping Up Committee. There is a group of us in Berry County that meet, and Rich is one of them with Christine. And as far as I can see, they bend over backwards to work with us. So thank you very much, Rich.
Yeah, you're welcome. If any of you have questions just on the services we provide, questions on could we do more, or why do we do this, feel free to give my office a call. We'd rather have that conversation.
Thank you. Any other questions from commissioners? Thank you, Rich. Public hearings, we have none. Items for consideration.
Mr. Chair, I would move for the approval of transfers and disbursements, approval of claims in the amount of $85,745.36.
Support?
Motion by Connor, supported by Smelker, for approval of claims in the amount of $85,745.36. Is there discussion? Hearing none, the clerk will call the roll.
Connor.
Aye.
Getty.
Aye.
Gibson.
Aye.
Jackson.
Aye.
Smelker.
Aye.
Campbell.
Aye.
Geiger.
Aye. Item carries. We have no unfinished business. New business.
Mr. Chair, I would move for the approval to allow TrueStream and the Berry County Chamber and Economic Development Alliance to apply for a federal broadband grant in the amount of $30 million on behalf of the county, with Michael Brown listed as the authorized organizational representative.
Second.
Motion by Connor, supported by Gibson, for approval to allow TrueStream and the Berry County Chamber and Economic Development Alliance to apply for a federal broadband grant in the amount of $30 million on behalf of the county, with Michael Brown being listed as the authorized organizational representative. Discussion. Good morning, Jennifer. So what do we have here? I thought we voted on this before.
Well, I mentioned it last time I was here, but now, let me give you a little bit of history. Talked about applying for this grant. I went to a webinar. They came to the broadband. That group chose TrueStream. So we started working on So I'm here to ask if we can, but under the county's name, a list of things that would entail. We're not only asking for the county to be listed, Michael Brown to be listed as the, but also to act as, allow Michael to sign an, allow Michael to sign a certificate. After there's been a contractual, for Michael to create space on grants.gov and allow all of us to upload documents. All of the requested information. I don't know if all of that is considered authorized organizational representative or not.
Speaking of transparency, with the non-disclosure agreement, that NDA would not prohibit the Board of Commissioners from gaining information, correct? Questions from commissioners?
Does Michael have time to take on this extra work?
Michael, do you want to comment on this?
Commissioner Getty had asked me that earlier, and my comment was that, you know, if we're capable of getting and leveraging $30 million or even up to for broadband, it's just too big of a project. It's too important to the community. We've talked about it for years and years.
Right.
As we look to ARPA, so I'm confident that while my name's thrown as on the front of this, if you may, politely, a lot of it's in title. If Jennifer and others behind her have done all the legwork thus far, and I have no concern that once the motion is approved that they're going to all of a sudden disappear, if you may. Everybody's pulling to make this thing work. So, but in a nutshell, if we can leverage and get $30 million for broadband, I think we've got to figure out how to
figure out a way to do it
and get it done.
Questions?
Jennifer, one thing I see in here is a cost-sharing matching clause in here where they're not requiring it, but they're looking favorably upon it if you're willing to put funds in on your own as well.
But we've got a lot of that covered with the engineering study and on for now, and then we are going to ask the townships that will directly benefit.
Okay.
Is there a potential map for what townships would be affected by this at this point, or is it still kind of in process?
We don't have,
Okay.
but it is 3,400.
Awesome.
What exactly will the 30 million be spent on?
Anybody who has Great Lakes Energy already has the power at home. They're going to add the fiber. So it's just adding the fiber, the lines to get to homes.
Okay. Additional questions?
On Great Lakes Energy, they're going to do this whether they get a grant or not, right?
But it may be. But yes, eventually.
They just came and spoke at Irving Township. There's a reason I knew that, but.
Well, and this money is spent in 1 year, so all of this project will be completed.
And does this TrueStream or any other vendors, are they associated with anyone we have in Berry County, like MEI or anything? Thank you.
And my only comment is that, I mean, I think we're fortunate to have Great Lakes Energy and TrueStream to partner with. They really have capacity to help us apply for this. We interviewed 2 companies, and Great Lakes, the infrastructure they have existing in their company to help Jennifer and the broadband team and EDA apply for this, it really was a big boost. And I'm not sure we could have done it with any of a smaller organization because there is a lot of heavy lifting with the grant application.
Are there any risks to the county financially? Commissioner Connor?
When 911 was putting down their optic fiber for their program, I mean, one of the things that we discussed was coordination of efforts with other utilities. Is there any chance that any need that might be there with other utilities or groups could piggyback and do it at the same time?
I don't believe there will be because the lines are already run for the.
Okay.
I will add, though, to address that, is Stephanie Lehman has been added to our broadband committee so that we can make sure that the dispatch concerns are being addressed whenever possible.
Okay, that's good. Thank you.
Any other questions?
They will be monitored, so they spend the money wisely.
But just to recap, the 30 million will get 3,400 households with? Thank you.
Commissioner Connor? If there are no further questions, the question before the board is approval to allow TrueStream and the Berry County Chamber and Economic Development Alliance to apply for a federal broadband grant in the amount of $30 million on behalf of the county, with Michael Brown listed as the authorized organizational representative. The clerk will call the roll.
Kenny,
Aye.
Gibson,
Aye.
Jackson,
Aye.
Smoker,
Aye.
Campbell,
Aye.
Connor,
Aye.
Geiger.
Motion carries. County Administrator's Report.
Have a couple of quick items. We're getting ready to send out the draft budget probably the end of this week. That was begin getting distributed. Don't anticipate although, we'll see, at this point, the way the budget's coming together, but it's something to think about as well, and if you want type of budget hearing. We will certainly in October have to have a public hearing. That's out into November. Adopt a draft of the budget for them. Out is August 10th, college. How might be a better timing. For us to get it out this week, next following week, have an appeal to our office, and then on the, I think it is August. That's assuming you with a regular meeting if you want it. The other is that the next now delegates to the MERS. So if anybody's interested in employee delegates for a conference here.
Questions for Michael? Thank you, Michael. I have no report. Vice Chair?
Thank you. Excuse me. So since our last board meeting, I attended the Prairieville Township meeting. They approved the interim fire chief, Brian Uridge, as the new fire chief, and Dan Hanikow as the assistant fire chief. The MAX Summit I went to with Michael and Catherine. We talked about the ARPA plan, worker safety with COVID. The current county plan is still in force, which that was very interesting. Even though some of the restrictions have been lifted, we still have a plan that is in force until the end of the year. Risk management. Then we went to one session on community foundations. Bonnie Getty was there and gave a really good presentation about working with community foundations. And affordable housing, how it should really be called attainable houses. When you looked at what your average constituent worker could afford and the prices of homes these days, it's so mismatched. So the fair was last week. I drove courtesy cars, a great way to meet a lot of great Berry County residents and other residents from other counties and cities. But
Are you saying not all Berry County residents are great?
no, but all the ones that were in my car were great. So I was actually part of a challenge that 4 youngsters had from other cousins that they had
really?
to get a ride and go around the fairgrounds. At first I thought, was this a gag or what's going on, guys? So it was kind of cute. So at Carewell Services yesterday, they had a public hearing on their second year of continuing services. They had a 3-year plan. We're in the second year of continuing services because of COVID. They just kind of went this way instead, and they will be sending that to us for approval. Planning Commission, we tabled a site plan due to some additional information needs. We denied a kennel request, approved an oversized building, and a request to operate a home occupation was withdrawn. And I was reappointed from that board to the Solid Waste Oversight Committee.
Thank you.
I have.
Commissioner reports. Start with Commissioner Gibson.
I attended the transit meeting. We presently have a position open for a driver. We're doing some parking lot repairs with A1 Asphalt. The Freeport Car Show is this Saturday from 9 to 3. Me and John Smelker talked to the health department. We talked them into coming over and setting up a clinic to do vaccines. And I volunteered 4 days at the fair. That's all I have.
Thank you. Commissioner Smelker?
I went to the Irving Township meeting. They had presentations on Great Lakes Energy and Internet, and had a lengthy discussion on dirt roads in Irving Township. So, and Hoot was already covered that fair. So, and hopefully everyone comes to the car show.
All right. Thank you. Commissioner Getty?
I attended the MAC conference. Vivian has reported on. I found it very informational, so I will definitely take advantage of those when they come up. I attended the Middleville LDFA board meeting. They're considering expansion of fiber in the village to attract businesses and industry to the area, as well as serve more residents. Thornapple Township is, I believe, has completed the application process to receive the ARPA funds. I hope our other townships are doing the same.
Great. Thank you, Commissioner. Commissioner Campbell?
Thank you. I did attend the Johnstown Township meeting. They had a very large crowd in attendance, which is always great to see people getting interested in what's going on in their township. They're working out a special assessment for a road at Walnut Ridge, which has been a very good topic. And also Sheriff Leaf did a presentation, in-depth report on traffic patterns on Hickory Road in the Fine Lake area, because speeding kind of continues to be a big problem there because of the logistics of the houses in the lake. And also I went last week and spent much time at the Berry County Fair, and thankful for Vivian and who saved my tired legs many miles. And it was great to see the fair return this year. So thank you.
Yeah, and thank you for filling in for me at the Republican Fair booth.
Absolutely.
About 2 hours after he texted me saying, I could probably help, I said, what are you doing now? Commissioner Jackson?
Good morning. Health Department meeting was last Thursday. They have ongoing concerns with the Delta variant of COVID-19 and the cases, the case that is in Berry County, just the transmissibility of that. So they're watching that closely. They're also working on their budget, so we're going through that right now. Governance Board for Economic Development was canceled. Animal Shelter was canceled due to a lack of agenda items, so it was kind of a quiet couple weeks outside of the Township Board meeting. So thank you.
Thank you. Limited public comment this time. Any member of the public wishing to address the board may do so for up to 3 minutes. Hearing none, there is no other business to come before the board, and we've reached the end of our meeting. Without objection, the board will now adjourn. Board will adjourn.